We're getting something on wave for the good old days, according to Voice. Welcome back to the Now Morning Show. It is always a good sign when we can do well and have good dialogue with our neighbors. And to that point, the USNS Comfort Hospital Navy ship is in Trinidad and Tobago from the 5th to the 11th of August. Free medical clinics at NAPA and so much more. We find out more now with Anita Sohan, Director of International Cooperation, Desk Ministry of Health, as well as the U.S. Embassy Port of Spain Senior Defense Official Captain. Now, I've been told to call him Captain Tech. Now, I've asked the pronunciation. I've been told to call him Captain Tech. Captain Tech, introduce yourself, please. Morning to both of you.
Thank you so much. The name is pronounced Teklegiorgis, but most people, because it's a little complicated, I am absolutely comfortable with the name Tech. I am the Senior Defense Official for the U.S. Embassy, and here I am so happy to share the studio with Anita. We had such a beautiful relationship with the Ministry of Health, and this is actually a good opportunity for say thank you to the port operation, the police, TTDF for all their support in preparation for this ship visit.
And once again, there's that point, that word of engagement, word of support coming together. Anita, what are some of these things that are happening during the time frame that the Comfort will be here?
Okay, so as Captain Tech said, we have a really great relationship with the U.S. Ministry of Health in particular has forged such a strong relationship with the embassy over the last few years. So this visit sort of underscores that. So we have two main activities happening. One at NAPA, which is a free clinic. There are medical services being offered to the public. It's a first come, first serve. It's happening from 8 to 4 p.m. The services being offered, you have general adult medicine, pediatric general medicine, dental, optometry, dermatology, some cardiology services as well. It's so, because of the crowd and the numbers we expect, it's, as I said, first come, first serve, but you're only allowed to see one person. So if it is that maybe you want to get your eyes checked or you have dental issues, you need to choose which one, prioritize. If it is that you choose dentistry, you get to see somebody and you finish, you could go back in line once there's time and probably pick another service or come back the day after and try to get in. The second initiative is surgery. So we're doing minor surgeries on board the Comfort, which is really exciting. The surgeries itself for all patients, they're being selected through the Ministry of Health using the waiting list from the regional health authorities. So we are choosing those persons that have minor complications and who has been on a list for waiting for a long period of time. So Ministry and the US team will be able to call these patients and let them know where it is that they could come in, give them all the details. Don't ask any public. Do not call the embassy. We will reach out to you for the surgeries at least. For NAPA, as I said, it's walk-in, open to everyone. And
that point, I'm glad, because I was going to ask whether or not you could call to get into NAPA, but in terms of hearing that is walk-in, and we'll come and speak about that in a little bit. But Captain Tech, just before we get into possibly some of the other activities, what kind of support is necessary? Because you mentioned some individuals like TTDF, for you to be able to engage in this sort of initiative?
Let me put it this way. The USNS Comfort is a hospital ship. We are talking about 1,000 personnel on board this ship. So coming to port is huge. So receiving that kind of support from the host nation is absolutely beneficial to make this mission very successful. This is a free service of adult medical, pediatric, optical, dental, physical therapy. This is the most beautiful part of what America can provide. We are talking about, if you're going to sum it up, if you were to put the 300 million Americans in one body, if you can put them on one body and you want to identify the heart, it would look like this ship. So the preparation, it takes a lot of effort, and having that support on the ground is absolutely crucial.
But at the same time, it seems as though, as opposed to just physical health, there's also a level of mental well-being that is being undertaken, because there are concerts, there's music involved. Give me a little information about that, thanks.
Oh, that's the best part. See, I know how you guys feel about your carnivals. Please follow us on Twitter and X, on Facebook. We're going to have 2 concerts on Friday, starting at 4 o'clock at C3 Mall. That's in San
Fernando.
Yes. And the second one is on Saturday, which starts around 7 o'clock. This is in Pan Grove, the area I couldn't remember.
Phase 2 Panyard.
Oh, okay.
So we're going to have these 2 concerts by the Fleet Forces Band. It's called the Uncharted Waters, a beautiful name for a Navy band. So it's going to rock the city on Friday and Saturday. So we are very excited about that.
Is it just concerts? Do you have the opportunity for a bit of workshopping and interaction? Because I know sometimes people like to meet different musicians.
Absolutely. You know, in the concert, in between the dances, this is the benefit of the cultural exchanges that happens. So you're going to see a lot of activities.
Okay, and Anita, I asked Captain Tech about the support that Comfort would need. What kind of work goes on before to say, okay, well, these are the things we need, even to say that, okay, we can bring the regional bodies in so that there's a lot of backlog that is cleared like that? What is some of the preparation work that goes on?
There's a lot of planning that goes on. So we work closely with Captain Tech and his team to identify what it is that they could bring to us and match it with what we need. So as they say, it's non-complex surgeries. We look at what do we really need, and we have, you know, cataracts is really popular. A lot of people need dental care. So we try to offer services that would really benefit the population, and work closely with the regional health authorities to get our doctors involved as well, because we want it to be an exchange, you know, to work together with the US physicians and share our best practices and really just help the population.
And you're going to see the medical team come from this ship, literally working hand in hand with the Trinidad and Tobago professionals to provide this free service to the public. You know, first come, first serve. You don't have to call the embassy, or there's no prior registration. This is simply first come and first serve. So the people on the ground, all we ask is for the public to just help, you know, perform a nice line so that as many people can be taken care of during this mission.
Okay, but the way that the regional health authorities will call individuals, they'd have an idea of their histories. What does someone need to work with in terms of diagnoses? What are some of the things that they can work with to help the process?
For those selected for surgeries, all the patient records will be shared with the embassy, and whenever the surgery is completed, we get the record, so that is kept with the regional health authority. So you have that on file. So there's no need to worry about all these details. It's being taken care of. So we will ensure that the records are sent to the embassy.
Okay, and that's for the walk-ins as well at NAPA?
For the walk-ins,
for the walk-in,
yeah, you
it's
don't need
all
anything.
at NAPA. For the surgeries, that's where you need the list, so that the medical team on board the ship have prior information to expedite the process, and also people don't need to come to the ship. But NAPA will take care of all the medical.
And in terms of that, because we spoke of the level of planning as already, is this something that will happen on a continuous basis? And I'm wondering, you talk about the exchange. What exactly is it that we, on our side, I guess Ministry of Health is offering?
So Ministry of Health will be at NAPA as well to provide support to the team. Our doctors will be there to assist in whatever way. We'll also have a setup to do health promotions and also have separate referrals. So if it is that you have some dental services provided and you may need a follow-up, we are there, so you could come to us and we will take the information and get you into the RHA system or to the clinics, whatever is necessary.
I like the fact that information is going to be taken like that. And sometimes people want to say, well, how much of a difference is this making? If this event or this initiative was not happening, how would we see that difference? Or how much does this help the situation as it is on the ground?
I think it helps a lot.
Let me answer that, because health is everything. And in any place, there's always extra lists that would like to be taken care of, but due to shortage, we cannot have 100%. Now, when you have hospital ship like this come, it can help put a dent on the backlog on the list. So that is the benefit of this ship that is totally independent. It's a fully capable, it has 100% independence to take care of medical support. So when they come in, they are coming early. So the host nation in this process, there's advantage to the interaction, subject matter expert exchange. And the support that you get from the host nation is with the facility, because the new personnel that's coming, they need to understand the culture, they need to understand the situation on the ground. So it's a good support to get from the health ministry in that regard.
And who are some of the other jurisdictions, countries that have hosted the USNS Comfort? Take a deep breath and a sigh before you start to list them out.
You can tell how excited I am. This is a beautiful announcement to make on a Monday morning. So the USNS Comfort, we are talking about going back to 2007. This is its 16th mission, sponsored by the U.S. Southern Command, deployed by the 4th Fleet. Now, this is the final stop. So it's been through Panama, Grenada, and other countries. So this is a way of showing in Trinidad the strong partnership that we have. So, and this is a commitment to the region from our side, a show of participating in the humanitarian efforts.
And I know we have some people already by the phone, they're excited, they're hoping they get that call in about 2 hours letting them know, and you already kind of curbed expectations about the type of surgeries that will be taking place. But what's the highest or what's the most engaged?
We are open from 8 to 4 for 3 days, starting Thursday, Friday, and Saturday. And first come, first serve. You don't need to register. You don't even need to bring your ID. The only reason why you bring your ID is in case you prescribe medication. So regarding the surgeries, all will be taken care of on board the ship. That's why we need the list from the Ministry of Health, so that those are separately. But no one needs to go to the ship. We don't want anyone to go to the ship because it's a hospital ship. And
yes, and I think you were saying is more of the minor types.
Yeah.
But in terms of minor to major, what is the highest type that you'll be getting on the ship?
See, now you're going to make us look like doctors.
So I'll give you the list, the types of surgeries that we do. So it's cataracts, we're doing some hernia removal, lumps and bumps removal, pterygium, gallbladder. We're keeping it simple. Because remember, they're here for a limited period of time, so they have to be able to, in and out. We don't want any complications, so as little need for follow-up as possible, although the RHs will be there to assist if it is that someone needs post-op treatment. This
seamless integration of the USNS Comfort as well as the RHs, always inviting people to go to primary care institutions first, because sometimes if people stop the two, they want to go to the hospital as opposed to. But you're going to say something, Captain Tech?
Yes, regarding the surgery, because the ship is coming for such a short period of time, they want to make sure what they start, they want to finish. That's why the surgeries are picked to where it starts and finish before they leave. So this is very important to put on.
All right, I guess that also raises an ethical point as well, so wanting to be able to provide the best care to the individual like that. But Captain Tech, Anita Sohan, we want to thank you very much for the work that is being done while the USNS Comfort is going to be here from it's the 5th to the 11th of August.
Yes, but clinics are from August 7th to 9th. Be prepared for some long lines. Walk with an umbrella, walk with a bottle of water. We will try to see everyone, accommodate everyone as best as possible.
All right, thank you once more. Stay with us. The Now Morning Show continues after this.